Right, welcome back. In this video, I'd like to really speak to you about what to do after we would have extracted a tooth. And hopefully by that time, we would have prepared you for a dental implants. Dental implants are essentially the best gold standard in replacing missing teeth these days. And there is a sweet spot where we are much more at a higher likelihood of being able to deliver dental implants without any additional procedure. And it all starts with extraction of the actual tooth that is problematic. During that time, what we end up doing is grafting the area with bone and letting it heal for a minimum of 3 months. We cannot do anything in the meantime. Before 3 months, we have to wait until the bone solidifies and integrates so that you become eligible for a dental implant. The sweet spot is between 3 months and 6 months. If you wait too long after the 6 months, what ends up happening is that right next to the site that had received the extraction, the teeth will start to shift. I want to show you here how the contact between the teeth is very tight here, and then it opens up with time, which then becomes a food impaction area. It creates gum disease, it creates cavities, it creates a tremendous amount of discomfort because now you're having food getting stuck in between your teeth that you did not have before. And so it's extremely important that you follow the timeline and act when you should act at between 3 and 6 months to replace your missing teeth. Now, let me show you also in between this row and this row, you see the difference here is that in this case, you did not receive bone grafting. And in this case, you did receive bone grafting where the bone quality is much better with the bone graft than without, but also the width and the height of the ridge, the area that will receive a dental implant, will be much more adequate in the case of grafting than it will be in the case of non-grafting. So what are the options available to replace a missing tooth? Let's again emphasize here that when you're missing a tooth, if you don't do anything within 6 months, all of these teeth surrounding the area will start to have cavity. As you see, all of these cavities here, as well as inflammation around the area because now the teeth are starting to shift. This is a huge deal because to fix this issue, you will need orthodontic therapy, braces, which take a long time. They are also unpredictable sometimes, and they're also costly. So the best way to prevent these things from happening is to essentially receive your dental implants on time. Now, let's go ahead and discuss in the meantime, after you received your extraction, within 3 months, the teeth will not shift just as much. So you will be in a good place even if you don't receive any replacement. Some patients still prefer to have a replacement in the meantime while they're healing before they receive their dental implant, and also during the time the dental implant is integrating in the bone, they would like to have a replacement. This replacement could be a removable appliance, or it could be a permanent appliance such as a Maryland bridge or a regular bridge. All of these options are could be temporary options, but also they could become permanent if you do not qualify for a dental implant for one reason or another. That's why the examination of your case will essentially determine which route we're going to go with your treatment. So let's go ahead and explain what this dental implant is. It's a titanium screw that is screwed into the bone that holds an abutment, which is the small piece of metal that holds a crown. So a dental implant really is a component that has three main elements: the implant, the abutment, and the crown. Each one of these will be essentially utilized at a very specific point in time, and they usually are not utilized together unless there are very specific cases where we could do all of them at the same time. For the majority of cases, each one of them, the screwing of the screw into the bone, waiting for the healing, placing the abutment, waiting for that healing, and then placing the crown, happen within some sort of a sequence that we have to wait for. But it all starts with an evaluation of your jawbone. As you see here, this evaluation requires a three-dimensional scan, not a two-dimensional scan. We have a lot of times some confusion where patients would say, oh, I just received an x-ray. Why do I need another x-ray? This x-ray is very special. It is a three-dimensional x-ray that allows us to see the bone available where we're going to place the implant, and also to see if there is any vital structure such as a nerve or such as a sinus, which is the breathing pouch that we have within the jaw, the upper jaw, where if we have a sinus, when we plan our implants, we have to evaluate how much bone available there is prior to placing the implants. That's why a three-dimensional scan is recommended and actually paramount. We have to take it in order to plan your case properly. Now, let's go ahead and discuss how an implant needs to have sufficient bone surrounding it for you to qualify immediately for a dental implant. Some patients do not have sufficient bone available even after receiving an extraction and a socket graft. Socket grafts do not guarantee that you will have enough bone availability for placement of an implant. They just enhance the chances that you will not need additional bone grafting, such as here, to essentially have enough bone availability to place your implant. And so it all starts with that extraction and bone grafting. And then at the time of planning you for a dental implant, we're going to then evaluate how much bone you have and what type of procedure you will qualify for. Equally, on the top arch, even though you did receive bone grafting potentially in the sockets, sometimes there is a phenomenon called sinus pneumatization or sinus expansion, which means that the amount of bone available to place the implant is insufficient, in which case you will essentially require another procedure called sinus lift procedure that allows us to add enough bone in the area for you to receive dental implants. And that's one of the reasons why the three-dimensional scan analysis allows us to truly come up with the treatment plan that is unique to you. Now, after we do the treatment plan, we essentially will identify whether you could qualify for a dental implant that goes into the site where you're missing one tooth, or potentially if you're missing multiple teeth, we're going to try and plan the case where we save you money by utilizing two implants to replace three missing teeth. That's why every treatment plan is unique, because it depends on the bone quality and the space that we need to replace to identify how many implants at the very minimum we could use to be able to provide you with replacement of your teeth at the lowest cost possible. You see here in patients who have essentially no teeth in the jaw, we can essentially place 6 implants and be able to give a full set of fixed prosthesis that is fixed on top of these implants. Some patients will qualify only for 4 implants, in which case they could receive a removable appliance that is essentially stabilized by the dental implants, but they are still removable. The appliances that the patient receives will be removable. Once you discuss your case, once we do the full evaluation, we will see what type of options you have to replace your missing teeth. So it all starts with the three-dimensional evaluation. So what to expect at the surgery and after the surgery? At the time of surgery, now the tooth is out. We have waited along 3 months for the extraction and 6 months if we decide to place an immediate implant. Not every patient qualifies for an immediate implant. An immediate implant is an implant we place immediately at the time of extraction. Only a very small portion of the population, depending on their case, qualifies for an immediate implant. Most cases qualify for an extraction first, and then after the extraction, with 3 months after the extraction, they will qualify for a dental implant. So once we place a dental implant, we're going to wait for 4 to 6 months for that implant to integrate within the bone. Once it becomes fully integrated, then we're going to reopen the site surgically. This is a minor surgery. So we're talking about a major surgery here and a minor surgery here to expose the implant, on top of which we're going to be putting this small little piece of metal called abutment. And usually we wait 2 weeks or so before the gum tissue heals around the abutment for us to start preparing for the crown. So let me back up a little bit again here just to show you that there is one surgery for the extraction, one surgery for the implant placement, one minor surgery for the abutment, and then a prosthetic phase, which is the crown itself. And you see how these timelines stack up on top of each other, where you have 3 months plus 4 to 6 months plus 2 weeks and 2 weeks. So we're talking about potentially somewhere around 8 months or so to be done with this type of therapy. Now, during the surgery itself, we always recommend nitrous oxide sedation, which essentially is a procedure that allows us to administer nitrous oxide gas that we give to kids, to grown up adults, to make them relax. There are a lot of advantages to administering a certain type of sedation. In minor cases, we use nitrous oxide routinely in the office. In major cases, we do use deep sedation and even general anesthesia. So, on the day of your consultation, we're going to discuss these different options and see which one fits best to your need and also is the most cost effective. But just to summarize what nitrous oxide is and what the benefits are, in general, nitrous oxide is an anxiolytic. It will essentially reduce anxiety and fear. It will also help you not feel the needles just as much, which is a great add on or a great advantage to nitrous oxide. And it generally relaxes all of your muscles, including the jaw muscles, which means that the procedure will be easier for you to handle. And after the procedure, you'll feel much more relaxed than if you didn't use nitrous oxide. In some cases, we do use general anesthesia or IV deep sedation, depending on the complexity of your case. Now, let's move on to after you receive the dental implants, how to clean those implants. If it's a small one implant site, you're going to floss and brush just like you would use normally, and that maintains the implant as healthy as possible over a lifetime. If you're receiving multiple implants, you need to use specific brushes that you will be introduced to in order to clean the areas beneath the bridge and above the dental implant. This prevents the area from accumulating food, but also allows it to remain clean so that doesn't develop inflammation. And that should solve all of our issues for now. I hope this video has been somewhat helpful explaining to you the general timeline, but also the solutions and the alternatives. And please don't hesitate to ask the questions you may have on the day of your consultation with me so that we make sure that you are on board to start receiving this dental therapy. Thank you and take care.